Everyday Iowa. Well, as we mentioned, summer is starting to wind down, which means it's starting to get ready to get back to school and the routine. Joining us, not one but two guests from the greater Washington County area. Sitting directly to my left, Kelsey Striegel, which is DNP. What does DNP stand for?
Doctor of Nursing Practice.
Okay, and next to her is Brian Murphy, ARNP, and of course we all know that stands for?
Advanced Registered Nurse Practitioner.
Thank you guys for being here this morning. First off, before we talk about getting families and kids ready for back to school, introduce Washington County hospitals and clinics. It's quite the makeup of buildings and quite the number of campuses you guys have.
Yes, what I love about Washington is that we just continue to grow, expanding the area that we provide coverage to our patients, and I just love that our service lines continue to expand. We have gynecology and oncology coming in the future, and I think it's just really important in this climate that folks have access to care, good care, close to home.
Well, and Brian, as we were just talking, you know, having it close to home, not having to make long drives, can be a lifesaver sometimes too.
Absolutely. We've got a very competent emergency room department, a hospital, 24-bed that is very capable of taking care of a wide variety of patients. We're very, very blessed.
Luckily, I've never had to see it. I would love to come down and visit sometime, obviously. You've got campuses on Washington. Where else are some of your guys' locations at?
Mediapolis, Kelowna, and Columbus Junction.
Gotcha. So you got all the bases covered. Now, if we want to meet you guys specifically, where are you signing autographs and working out of?
We're both at the McCready Clinic.
Gotcha. Okay.
Yeah.
We're seeing some pictures here and some video. So obviously, medical care is important when we talk about men's care. We talk about women's health care. But let's talk about families. You guys want to focus on getting ready for back to school time. So you've put together some handy tips for us. Where do we start? Kelsey, I'm going to start with you. Where do we start when we wrap our arms around, all right, it's about that time of year again?
So I think it's really important to make sure you get your back to school physical, start scheduling your sports physicals, you know, eye exams, dental exams. We really try to focus on care of the whole person. Your mental health, your physical health, making sure that you're up to date on immunizations, and then really what I like to focus on is like prevention and anticipatory guidance with families. So making sure that we've talked about, you know, what are kids doing after school? Do they know, you know, moms and dads, you know, phone numbers, the address? Are they going to be safe, you know, walking, riding their bike? Have, you know, we made practice walks and you know, rides to school. And just keeping families safe, you know, new teenagers driving, you know, on their school permit for the first time, just all of those things that will keep kids safe, you know, getting back in the bedtime routine, making sure we're reading, having meals as a family.
And when you talk about the preventative, obviously the sports physical, even in middle school, I think I remember I had to go get a sports physical when I would play sports. Brian, the importance of that is twofold, and one, because you can see, all right, maybe you need to work on bone density, or hey, you need to be careful, but the other is, you know, just make sure you're healthy when you're running up and down the court in a field like that.
That's just it. It's not just for the school physical itself, not for the sports physical, but the preventative cares and making certain that children are developing. I'd also say that this time is a good time to reflect and say maybe the parents also need to consider when was my last well visit, and considering some of the regular screenings that we do for adults as well. Prevention really is that. We're trying to prevent disease, and getting patients in annually to see us is imperative that we can nip some of this early on, rather than catching it down the road and do secondary or tertiary prevention.
Kelsey, one of the last things you said was very important, routine. How do we get back into, we've been sleeping until 8, 9. I talked to one kid who sleeps until 10 every morning. How do we get back to that normal routine?
So I think it's kind of look at what your day is going to look like. What time do you need to be at school? So then to get your 10 to 12 hours of sleep, what time should you be going to bed? You know, are you brushing, flossing your teeth? Are you reading stories as a family? Are you cutting the electronics? We see so much of that. Sleep hygiene is so important. So getting in that routine now while you still have a couple of weeks, otherwise it can be really difficult if you wait right until school starts.
In that transitional time, the third bullet point there, the mental transition, getting back into the, all right, I don't have this much free time now and got to buckle down and get homework done and stuff like that.
And I just can't stress, you know, talking to your kids about kindness, bullying, you know, what expectations are for the school year.
At school and online.
Yes,
oh, absolutely. Stuff the three of us didn't have to worry about when we were going through school. And then last is families taking little steps. A little bit means a lot, doesn't it, guys?
Absolutely. And we just want to be here to partner with families. It can be hard, you know, not everybody has good access to care, but we really try to get our patients in and know them on a first name basis. And we have MyChart and a lot of resources to really be there to interact if a problem does arise. We want patients to be able to get in to talk about those things. We want to be able to address their mental health. We have a psychiatrist as well as 2 nurse practitioners, as well as a therapist that'll be joining our mental health practice. So it's really important. I just can't stress enough, care of the person and their body and their mind and
Entirety.
their spirit. Yeah.
And our next graphic, which we're looking at here, is the lightning round. You talk about meeting the hospital on a first name basis. You got some opportunities to do that, starting with the clay shoot coming up on September 26th. Tell me just a little bit about this event here.
I would refer people to the Washington County website. That'll give a little bit more information on that.
Gotcha.
It's going to be on the 26th from 10 to 5 at the Highland Riverside.
Out in Riverside. So
Yes.
there's more to Riverside than just the casino, everybody.
Apparently.
Item number 2, the Pink Night coming up in October, which is going to be here before you know it.
Yeah.
One of those same deals. Get on the website and learn more about that and how to be a part of that
Yeah,
too.
that's one of my favorite events. We can schedule women for their mammograms, and it's just a really good event to create awareness for breast cancer. And there's a lot of just fun that happens there, and just fellowship, and you can meet staff from the hospital. So it's a really fun experience. So I would encourage women to come out and participate.
And as Brian mentioned too, get a hold of the hospital, learn about all those events, even schedule those preschool physicals and all that stuff. All the information there too. So thank you guys for coming in this morning, for making
pleasure.
the long drive. Make sure you hit the snack bar on the way out too, all right? Brian, good to see you, sir. Thanks
too.
for coming down. All their details at kcrg.com. We're going to take